Hello. Today I'm going to expand a bit further on possible effect of abuse on our emotions and mind. So our mind likes to be organized. So if we think about, there are a few bricks and that was nicely put together to build the wall. That's how our mind is in the normal circumstances. Now, I view abuse as a trauma response, trauma event. And when a trauma comes, for example, if somebody comes and hits that wall, a car comes and hits this wall, and all the bricks fall down, the structure of that wall is completely gone. Now the bricks are still there though, but they are lying in a pile. And that's what happens. That is this simile that I can use to explain what happens to our mind and emotions after a trauma. And due to the nature of our mind, it doesn't like those bricks to be left in a pile. So it wants to organize it. So what happens after a trauma? The mind goes back to again and again to that event, trying to figure out how to put those bricks nicely, neatly in a form of a brick again, a wall again. But sometimes it can't. And that's where it differs from person to person. Some people's mind goes back to the event and can sort out how to put those bricks into the shape of a wall. Sometimes people might be able to build a partial wall, and sometimes people might not be able to start that wall again at all. Now, this is where perhaps biology kicks in and our past experiences kicks in. Sometimes past experiences helps us to build the wall. Sometimes it's not enough. Now, that's why I emphasize on the fact that the responses somebody after abuse can show, it's not their fault. Sometimes it's beyond their control. To outside world, it might look like they are not trying hard enough, but actually they might not be capable of dealing with it. And this what leads into what could be the presentation. Now, after abuse and trauma, people are given different labels. Now, I feel like those labels only represent the symptom. Some people are given the level of PTSD, post-traumatic stress disorder. Some people are given borderline disorder. Some people are given bipolar. But I feel like that going down the diagnosis route, there's a risk of missing the cause of what is stopping us from putting those bricks back into wall. Sometimes we might not be able to put those bricks into the wall, but at least we can try. But sometimes we can cope with it without putting them. But until those bricks are dealt with, the mind goes back to that pile of bricks again and again, and that's what it can happen in subconscious mind or conscious mind. So we might not be aware of it, but every time it goes back, it experiences that trauma again. The trauma doesn't leave them. So as a result, any survivor may not be able to come out of it. So, and it can have an effect on two levels. Number one is the thoughts, and number two is the emotions. Now, I've talked about before is that according to cognitive behavioral therapy, our thoughts leads to emotions. Now, it depends. Sometimes people can slow down their thoughts enough to catch their thoughts, and they can, if they can do that, they can start dealing with the thoughts. But sometimes the thoughts happens so fast because the trauma event is being repeated, played again and again in background of the mind so much that it might be very difficult to slow it down. And that time the starting point becomes just noticing the emotions, because thoughts leads to emotions. People might not be able to focus on the thoughts at all. They only can see the emotions. And that is the principle of dialectical behavioral therapy, DBT, which is another treatment method. So if you have experienced any abuse, all that I wanted to say, the way you are feeling or the way the world is perceiving, sometimes that takes over the survivor, is normal. It's just because your mind hasn't quite sort of figured out how to sort out that pile of bricks. Thanks for watching my video. I hope this makes sense. If you have any comments, please let me know. I wish you all the best.